Hi, Bustmob. It's Dr. Roughton, and we are going live on November the 1st. Happy Halloween to all you that were likely trick-or-treating with your children. And it's about 4:30, and we're going to go through some questions today. This is going to be posted in Bustmob, but if you're seeing a little piece of it on another platform, you can sign up at bustmob.com. And please join our community. We're about 42,000 strong at the moment. Let's see here. So thank you for putting in your questions. Just like always, you can join me live in the video. Most of the time, due to technology, whatever's, I'm able to see your comments as they come up. And if I don't, well, I don't know. Try to keep putting them in there, and I'll try really hard to find them. So here we go. Heather wants to know, how long does a breast implant and breast lift last if you're doing it for the first time and you're over 50? And is there a maximum number of cc's? So is there an implant that's just too big when you're over 50? So there's not. There's no age association with size of breast implant, so I wouldn't think twice about that. How long does it last? You know, it lasts forever. Sorry, I drank a big soda right before I got on here. It lasts forever, but kind of. So the lift part lasts forever, but you're still aging. So once you've had a breast lift, it would be highly unlikely that your nipples would ever go back down, but just like the rest of our bodies, my face skin, my neck skin, and what is that? It will kind of sag and age with you. You know, a facelift is forever too, except you're kind of starting over at a new start point. So things that will accelerate the droop again, the redroop, if that's a word, would be like having another baby, which at 50 you're probably not going to do. Gaining or losing a bunch of weight, probably more than 50 pounds. Those things can, weight changes and hormonal changes can make the breast change. Otherwise, it's just going to age with you. Now, implants aren't forever. I know it sounded like that when I started that discussion. Saline implants on average about 8 to 10 years before one ruptures. You know it's ruptured because you immediately deflate. Silicone implants, the latest and greatest, the highly cohesive implants, form stable, whatever terminology, gummy bear you might hear. We assume they're going to last 20 to 30 years before they rupture. The FDA, remember, suggests screening your implant for rupture if it's a silicone implant because they're now solid on the inside, so you won't know that it's ruptured because it won't change shape. Okay. Amy says she's 3 weeks tomorrow from her breast dog and breast lift. The compression garment compresses me so much when I take it off for a shower, my boobs are flat, and then they are sore from being flattened. Side note, I'm in a one-piece bodysuit from thigh and arm lipo. I was going to ask my plastic surgeon about it, but since you're looking for questions, I'm asking you as well. I don't actually think the garment is going to fundamentally change your breast at all. So if there's a way to have your breast out of the garment, that's fine. If there's a way, it sounds like there's probably not. Likely that's your stage 1 garment, and your stage 2 garment, which I don't know exactly when they will change you over, but your stage 2 garment's probably a little bit more comfy. But yeah, I think it's probably an individual surgeon question because I'm not even sure that the garment does much of anything other than just for your comfort. So for my patients, if you're not comfortable, get that off and do something else. Stephanie wanted to know, she says, not boob related, but what are my thoughts of the PDO threading? Would you recommend it for the popular fox eye trend? I don't know much about that stuff. I'm nearly not an expert in facial aesthetics. Threading, so what is that? What is it even talking about? I guess I can give you some background. A facelift, actually, the surgeon dissects the skin this way and then lifts the skin and the muscle and hides the scar in the ear and trims off some skin here, and then often the scar goes back into your hair. But that's pretty invasive, right? You have to do a lot of downtime, a couple weeks before you really can be in public without people thinking that you gotten beat up. So this threading technique comes and goes. There was something years ago that was something about lifestyle lift, I think it was called, but I think they went out of business. But instead of all of that, the surgeon just threads a needle under the skin with an anchor, okay, and does it at several points and then pulls the other side of the anchor back and lands it in there. It's not going to give you the same result a facelift does. It's not going to last as long, but it probably does okay for a little bit. The problem in general with those things is they don't last very long. The result of that probably doesn't, you know, facelift we think every 10 to 15 years once you've had it. You won't get that kind of result. Those are more temporary temporary results from the threading. I'm a little skeptical about things that come and go, and they're pretty pricey, but maybe. It's just not my expertise. May wants to say, what's the best method for scar management? Silicone tape, silicone gel, or bio oil? And what about laser? I think my first thought, is that in general, time is your friend as far as scars go. There is a natural history of inflammation where the scar is supposed to be thicker and redder at first and then flatter and more similar in color to your normal skin. I am not sure that any intervention at all does better than time. If it's something, it's got to be friction with temperature and pressure. So whether or not you're actually just really good about using your bio oil or booby butter or whatever it is, scar salve, it's the rubbing it in part that probably matters. And then if you're not going to do that, then I think that wearing the silicone tapes makes sense, because that's going to also increase temperature and pressure right on the scar. If you're a lazy patient like myself, just give it time. It's going to settle out. When would I use laser? When it's not behaving itself. So by about a year, your scar really shouldn't be all that red anymore, unless, caveat, super duper duper fair skin redhead, it's gonna be red for a really long time, because your skin is almost translucent. So any extra inflammation or blood supply in that area will be red. Otherwise, if it's still red there or it's thickened, I do think that laser works pretty well for color. And then sometimes like a skin pin, which is microdermabrasion, real dermabrasion. Sometimes the lasers like CO2 lasers that are destructive, they can help with hypertrophic scar. The thickened scar, my go-to is just inject that with a little steroid and see if you can get it to settle down. But most of the time you're going to be just fine. Savannah says, what is the cause of nipple numbness? Can it be avoided in a crease incision under the muscle implant method? Is it an unavoidable complication or a surgeon mistake? It's never going to be zero anytime you're operating. Anytime you're operating in an area, anywhere in the body, you are cutting through nerves. We know some big named nerves that we don't cut through, and we specifically look for. We make incisions here, we're looking for the great auricular nerve that goes to the ear. When we have lacerations or facial things, we know about the facial nerve. So we know about motor nerves that move the face. Sensory nerves, they branch so much. By the time they get from where they're coming out of the muscle to this distal part of your hand, they've branched 1,000 times, or etc. Like we think about when you're this side of the eye, there's so many branches that you're never gonna be able to identify, oh, that's a branch of the facial nerve, or that's a branch of the antebrachial cutaneous nerve, or whatever. Similarly, in the breast, because we're doing a surgery and we're undermining, so the incision's this big, right? But we're making a plane for that implant to live in. There will be teeny tiny branches of the intercostal nerves that are coming up through the breast and the muscle. By definition, some of them will be divided. So I would say, although I could envision a scenario where it was a surgeon's mistake, I would say most of the time it's unavoidable. It is uncommon to have numbness after a crease incision under the muscle implant. It is not impossible. It is most likely temporary if you have it, and I suspect your nipple sensation will come back. Nerves conduct electrical signals, and they can have trouble with that if they're swollen, if they're stretched, or if they're cut. So it may not be cut, it may just be swollen or stretched and needs a little bit of time to come back. But I don't know of any way to say you have a zero risk of it. What realistically can be expected from a lift only done in your late 50s? About the same you can realistically expect when you're younger. Does pretty good. Alicia says, 5 months post-op lift, getting implants next week, plan on getting nipples pierced in hopes of bringing feeling back. How long after the breast aug should I wait to do the piercing? It's probably surgeon dependent. I would tell you about 3 months. By 3 months, that it should all be, like the nipple should no longer have any connection at all. If I think back through, like, if you have a little diagram and this is the nipple and this is the breast, like there shouldn't be any anything that was severed when you were putting the implant in should be well sealed and healed. How much should you be walking on day 4 post-op after mommy makeover? At least around the house, right? Like you should at least be able to get from the couch to the kitchen table, to the bathroom, to the chair. I don't think you have to race walk at the mall yet, but you should be moving around pretty good every 2 or so hours while you're awake. My nanny is texting me that my son is at swim lessons and refuses to get in the water. He cannot have any candy from his Halloween candy if he does not. I'm tough. I'm a tough mom. Okay, back to you guys. Sorry about that. Quick little intervention at the swim lesson. Let's see. Taylor says, how soon after breastfeeding should you have a consult? I'm not going to operate on you until at least 6 weeks when you're after breastfeeding, and I would say it's probably better to wait about 3 months. At our consults here, I know, mom moves. I'm like, excuse me, 1 second. You tell that little sucker. He's 4. He's very cute. Going back to you guys, a little ADHD here. We're going to take a picture of your breast. We're going to take a picture of your breast with a machine called a Vectra, if you're thinking of implants, and then we're going to simulate what different implants look like on your body. So many of you may know, I certainly know, that when you wean that kid, like, it goes from like, oh, I'm going to keep some of this, to like, no, it seems to be going away, until like one day you lean over and it's like this empty sack in your bra. And so I want to do the Vectra when you're closer to how your breast is going to look finally than what it looks like when you're just weaned, because I think it'll help you with picking size a little bit better. So essentially 6 weeks to 3 months after you wean is a good time to have a consult. Anything non-surgical that can be done about loose skin from under the chin for weight loss? So not really, not non-surgical. There are some things, but I'm not sure that you'll find them to be, let me back up a second. Yes, there are some things that you can do. I am a surgeon and I expect immediate, totally different results. You can do ultherapy, which is ultrasound energy, and literally it zaps, 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 and you get a little bit of skin tightening, but you have it, there's like 500 different zaps. And so if each one tightens like 1/10 of a millimeter, well, that's fine, but you do it 500 times. So that's like 5 millimeters, 50 millimeters, if you do that math. I'm not a mathematician. And it's FDA approved for a brow lift, believe it or not. So like you can zap your forehead and it lifts up your eyebrow a little bit. To a surgeon, these results are subtle. To a patient, it might be all you need. The other option is you can use a different type of energy, typically radiofrequency microneedling, which is another way of transferring energy, also zapping. It goes a little bit faster, it hurts a little bit less. I recently had it done, actually, and I'll be darned if I think I see a difference. It also did wonders for my little like age spots. So we happen to have a Morpheus 8, if you're thinking about that. But I will tell you, if it's more than just a little bit of loose skin, you probably want a neck lift, because you're going to be bummed out. And then liposuction alone, as you guys probably already know, it doesn't make skin tighter. So if you have loose skin and like a little fat pad under here, you shouldn't have me liposuction it, or anybody, because it's just going to make the skin looser. So it might be consultation for a face or neck lift. Let's see. The binder used for the first week after tummy tuck looks really uncomfortable. Is the reason you have to use that for a week over the shapewear it's easier to get on? I think your answer's right. And I think it's a really smart question. That was Rebecca's question. In fact, we were just saying that here at Amelia and Raleigh. We were like, man, our patients are really uncomfortable in this stage 1 garment, and I've worn it. It is uncomfortable. At least for me personally, there's a couple of problems. We're really going to talk about all my personal things here. The crotch piece isn't very compressive because it's got like a window to pee. And so what happens is you've got all this swelling, especially if I did Mons liposuction. But you have swelling anyway that's coming down towards the labia from all the liposuction, and then that's the only place it's not compressed. So you get the like purple hot dog look, which is not super sexy. So then if you're like me, I cut the crotch out of it, but when I cut the crotch out of the thing, then it rode up and I couldn't keep it down. So we have thought about maybe we don't even need stage 1, maybe we use the stage 2, but then the downside is I don't know how to get that, like, it's like a one-piece bathing suit. on an unconscious person. Like that'll be really hard. The stage 1 garments, they have zippers or they have hooks or things like that. So, I don't have the right answer. We're actually in talks with one of the garment makers right now to see if there's a way that we can get a better fitting, more comfortable stage 1 garment. But at this moment, I hear you, and I think you're right on. It's because we can't get the second stage on you, and then following that up a step further, you're not going to be able to get it all the way down to go pee. Like you might be able to pull it to the side, wet bathing suit style, but I don't think, especially in that first couple of days, not everybody is going to be quite so nimble to pull their garment to the side. I'm not sure the answer. What is the typical time frame? Did I get all of these? Yeah. Okay. Typical time frame, Mallory says, for tummy tuck, breast dog, breast lift, incision soreness pain to go away. I'm 4 weeks post-op tomorrow. Like when you mash on it, I would say real soon. That deep pain, the tightness in the abdomen, 6 weeks, 8 weeks, that takes some time. Is itching, Jane says, normal 1 week after a breast dog? What can I do to relieve it? It can be. The other thing is you might be having an allergic reaction to one of your medications. If you're itching all over, it's probably a medication. Narcotics are prone to doing that. So if you're still needing to take narcotics, that's one thing that might be making you itch. If you're on an antibiotic, sometimes you're allergic to it and that's making you itch. The solution for itching, depending upon where it is, you can either do something like Claritin or Benadryl, so an antihistamine. If there's a rash, you can use like a topical hydrocortisone cream, but probably most importantly is stopping whatever's making you itch. Sometimes people describe itching when an area of the body's swollen, and that it could be that. It's just hard to know. I would look for those other things too. Katie says, if you have implants and you've had your folds lower, does this take longer for breasts to settle in shape? Probably, yes. I don't know the answer to that for sure. Like, I'm sure there's not a paper on that, but it would make sense to me that it would. One of the things that can happen, often when you have your fold lowered, it's because it was really high, meaning from the side, your nipple to crease distance, nipple to fold distance was relatively short. So the implant, which with the implant in, which is by definition bigger than your breast, it's going to recruit some skin of your abdomen up to cover the implant, and then that old crease is sitting right on the implant looking from the front, and that's called double bubble. So you can see the crease of your natural breast and then the crease of your implant, and sometimes it's worse when you raise your arm in the air. That will get better with time. It may never be perfect, but that will get better with time as that old fold stretches out. Okay, Jane's giving me more information. No rash, off meds. Is there still tape on your incision? Because you could also be allergic to the adhesive. That would be the only other thing I can think of. Valerie says, should you run in a high support sports bra post breast augmentation? Is medium support okay? I think medium support is fine. I think whatever you're comfortable in is fine. I'm not a big believer that if you wear a special garment forever, your breasts look different than if you didn't wear the special garment. So I think it's wear what makes you comfortable. You're not going to hurt anything. Especially when your implants are under the muscle, they're right next to you. Like they're not flying all over the place like natural big boobs would be. I can act that out again if you guys are interested. Crack myself up. Okay, here we go. Moving on. Tiffany said, I had an implant released 5 months ago that hadn't dropped. It is now a lot lower than the other side. Will doing a lift correct that? Surgeon said I was borderline in needing a lift when I got implants, and I opted to go without the lift, which I now regret. They are much saggier than I want, so I'm scheduled for the lift next month. My pre-op appointment's coming up. What should I ask? That was a lot. It's not, it's hard to know. Because sometimes, and I mean this kindly, sometimes what you guys might tell me is a lot different. I might be like, oh, it's not that different, and so I think sometimes it's hard to answer in words. What I would say is if the implant, it is also possible that your implant is sunk beneath the crease because the depth, in order to get an implant to drop, when it doesn't drop on its own, we have to release or cut through the bottom of the pocket. Well, guess what's right there? The fold. And so they don't have like road signs on it, that says like, I'm the fold and like I'm the pocket, etc. So it's possible that it's now over released and you have bottoming out. I don't know without seeing it. There's absolutely nothing wrong with having a lift as a second stage. And so you can ask about that. But if the implant is bottomed out, the lift won't repair that. It'll just move the nipple and the breast tissue, but it won't move the implant up. So I think probably some things to go into your consult or follow-up visit with is a really good understanding of your before picture. Because if you had asymmetry before, the surgeon's unlikely to be able to make that completely the same side to side. And then ask if if the surgeon thinks your implant's now too low, and if so, what's the plan for that? And then go ahead and do the breast lift. I love my breast lift. Like, it's incredible. And just like you, I had implants first. I had another baby, so it's not really anybody's fault there except for my decision making. Although he's really adorable, but he doesn't want to go swimming, you see. And then I had my breast lift second, and it's been really wonderful. Okay. Dustin said, I just had my breast aug yesterday, and doc gave me tramadol. I'm so sore, it's not helping. Should I ask for muscle relaxers? Will the tightness go away when you remove the ACE bandage? You can. You can ask for that. It might help you. Some things that might help you even more is to start doing some stretching. Arms up over your head, arms up on the sides, because what I think might have happened is, it's natural if your implants are under the muscle. This is pec major, my big hands. You just had this big implant under the muscle, so your muscle's angry, it's sore, it's swollen, it wants to know what happened. I guess it's not a person, but if it was, it would want to know. So what do you naturally do to take the tension off that swollen muscle is that you roll your shoulders forward, okay? So now the muscle gets tight. And now not only is your pec major, this muscle tight, but oh my God, your trap and your rhomboids, they are mad because they're overstretched. And so you're in this kind of bad cycle of I'm hurting, I can't get any more forward. Oh my gosh, my back hurts. And so probably the first thing is try to sit up a little bit, reassure yourself you won't hurt anything, and then really start to do some soft, slow stretching. And you want to do a little bit every 10 or 15 minutes while you're awake. You want to really do that. If you can do that, you may not need any more drugs at all. Muscle relaxers are weird. They don't really relax muscles, but they can help with pain in a different way. So I might try that. You can put a heating pad on your back, and you can put, you're finally swimming after crying a lot apparently, and you can put ice packs here on your breast. Just remember with the ice packs, you've got to do like 15 minutes on and 15 minutes off because you don't want to give yourself frostbite. EJ says, should you be walking straight by a week? I think most people are if you push yourself to do so. I'm a wimp. I was definitely not walking straight by a week, so I'm not mad at you if you're not either. But you'll feel better because the same thing is true in the abdomen. You lean over to take the tension off your rectus abdominis, your six-pack muscles, but oh my God, your lower back is pissed. So I think it's a balance. Taylor, who is commenting on my necklace, is one of my surgical techs, and she is trying to get a rise out of me. But they're my birthday necklaces, so thank you. I'm glad you like them. Okay, moving on. Let's see here. If I have a wider base diameter, can I still go with smaller implants? Definitely not the go big or go home type. You absolutely can. What you might want to do, like if you're truly wide, and sometimes we have this misconception that we're wide, but we're not wide. But let's just say you got measured, your base diameter is 15, but you're thinking of going like 285 or something smaller. You might just want to look at the lower profile implants because remember, profile is going to give you height and width. And you don't want to have like a teeny tiny implant if your breast is bigger than that. So it's probably just a lower profile, and then it'll be perfect. Elise says, do I need to be at my goal weight for mommy makeover, or can I continue on my health journey afterwards? After 3 C-sections and breastfeeding for years, she's putting in the work, but feels like the apron and sagging and deflating breasts are making me struggle. Yeah, absolutely, 1,000,000%. And it's hard when you're trying to cover all that up to keep exercising, and at least for what the patients tell me, they struggle with body image. Like they're working so hard, but the skin's just getting looser. And then depending upon how much weight, I'll say like for sure my patients that have lost 100 pounds, they have a lot of misconceptions about what is loose skin and what is fat. And so the more they work out, they're getting looser skin, but they believe that they're getting fat because they can pull it and touch it and move it. That is not fat. Now, what is also possible is if you have your mommy makeover and you lose another 40 or 50 pounds, it is possible that you'll have a little bit more skin laxity than you would have had if we could have done it when you were, what is going on? Don't wear a hat all day and then wash yourself on a camera. If you're able to wait until you're within about 30 pounds of your goal weight, I think that might be better, but I get it. That sometimes you just need to be done with that loose skin and then you'll just deal with whatever later. You'll deal with the consequences of that later if it needs to be touched up. Let's see here. Dustin is just asking, oh, she'd already asked that, but she asked it on the live about her pain. I don't know if the Ace Wrap is going to help her. If it's digging under your arm, it'll help to get it off for sure. Ivana says, is there a way to help contour the abs during a tummy tuck to make it look more natural with an abs look to it? I know some doctors will use foam pieces during recovery. Is this something you guys do as well? I tend not to unless sometimes with the progressive tension sutures, depending upon everybody's, anatomy is a little different. Like you might have a little indentation or something or a crease forming, and then I want to push that away. So I'm not a huge fan of liposculpture. There are people who do it and there are people with great results. Liposculpture means I'm going to etch with a cannula like in between your muscles, in between your obliques and your six-pack muscles, and then transversely between each little indentation of the rectus abdominis. My concern with doing that is that it doesn't, to me, look very natural. And that if you gain weight afterwards, you are going to look like a Teenage Mutant Ninja Turtle. And I don't really love that. Or some people say like a marshmallow. So what I like to do is to just liposuction aggressively during the tummy tuck, which thins out like the cover over top of your muscles. And then as you do the work, as you put the work in on your abs, you will see it more because they are right under the surface rather than being like, covered in a thick layer of fat or a thicker layer of fat. So that has worked better in my hands, but you can certainly find people around the country. Like there's different surgeons for different people that are really good fits. I'm not sure, I guess going back to your question, sorry I didn't answer, is that I'm not sure the foam is what's creating that look. I don't think it's the foam. I think it's whether they're liposculpted, I think is the word, versus how much natural muscle tissue they have. When the belly button is healing, is there any way to make it stay in a circle shape instead of a coin slot? People do that. They call them like belly button trainers and they put, gadgets in, silicone balls, etc. I'm not sure that it's the ball thing that's doing all the work. I think one of it is, did your surgeon take out a little piece of skin right there? Like I take out a piece of skin, I have found that to be better. There are super conservative surgeons that will not take any skin out. They believe that if the belly button has any trouble healing, at least they haven't lost any of their abdominal flap. At Amelia, we all take out a piece of skin there. And then I think, at least in my hands, what's worked really well is to defat that area. So I'm done with your tummy tuck. I've got my finger underneath to figure out where your belly button is. Okay, I've found it. I mark it, like X marks the spot. I design my little, my little pattern to make your belly button. Take a little piece of skin out and then all of the fat around it and then a little bit wider than the skin itself. Because, it's coming, they're right on my buff board. When I do that, like this is the hole I cut for your belly button, let's say. And then I'm gonna try to take out some fat underneath the skin that now it looks more natural as it curves in like this. If you're looking from the top, like I would like it to kind of curve down like that so that when your belly button, because it's down here, now we're looking from the side. When I sew that down, there's like these little fat globs are now gone, so it's thinner there and it'll That's not the best drawing, as I know you guys know. None of my drawings are the best drawings, but let's see, maybe more like that. Maybe more of a smooth thing, because I took those fat globs out that used to be right there. But I don't know if that, I suspect the only time I see slips, or more often slip than not, is if you have a lot of laxity left to right. So this way, in addition to this way, it's hard, you can't ever make the belly button smaller. Like once it's big, it's big. There's no cinching it down or whatnot. So I think we're all a little bit afraid of making it too big. There's laxity left and right, right? So if you want a round circle, imagine how much skin you might have to take off to make it look round. Well, you're scared to do that because you don't want a belly button that looks like that. That would be the worst. It is, and I have gone back to revise people that want it rounder. I could just take like a millimeter or two of the skin later, just with numbing medicine off, and then just bring a little bit more of that native belly button to the surface. Let's see. Can you advise what will happen? Oh, this is good because I had this. Can you advise what will happen with old belly button piercing scars or closed up holes after a tummy tuck? Getting mine with you in December and really don't want to see them or for them to be above my tummy tuck scar. And she's got a picture of somebody that has that. I am going to try very hard to get your piercing out. And in fact, one of the things I did today was a second stage, take the piercing out. Let me draw it. And so maybe it'll make more sense because we are not leaving those there on purpose. Okay, this is you before the tummy tuck, right? Like this is your belly button and it has those two holes and you've taken the piercing out because, you know, whatever, you had a bunch of kids just like me. Okay, so now your surgeon, me, wants to get your scar as low as possible, right? So I'm gonna cut right on that belly button, just like that. And look what I left right above there, your piercing. And then I'm gonna take all of that skin away. And then this is gonna move down to meet the bottom, right? Okay. Okay, so when I did that and I moved all that down, look what's right there, that piercing scar. If I were to take it out in the first stage, and this is only for people that have a really small amount of extra skin or a high belly button, if I take this out in one stage, let's say I take this scar up really high like that and I get the piercing out, that might be where your lower scar is and you're gonna be mad at me. And getting that to come down as a second stage, much more difficult than like what I did today. Okay, so you have this nice low scar, it hides and everything, but as you pointed out, you have these two little dots from your old piercing. Well, we'll just take that out, that little bit out as a second stage. We'll just take out that little triangle under numbing medicine, and then I just line that up and I close it up and you just have a little scar revision right in the middle. That's easy. That's an easy recovery. It doesn't mean we have to redo the whole tummy tuck and lift up the upper flap again. It's just a little skin thing. Because why is it possible now but it wasn't 6-9 months ago? Because skin stretches and you have a little bit more laxity. Once it's all healed down there, you have a little bit more elastic to the skin and we can get it done safely as a second stage. So I get it. I know you don't want that there. I don't want it there. But I do believe in certain people it's better than the alternative, which is to have a really high scar you can't hide. Jackie says, is it possible to have a lift a year post implants? And if yes, how is it done? The same way I would do it if you didn't have implants. You go to sleep. I cut out my little pattern, move the nipple up and close the breast around it. And generally takes about an hour and a half total, including going to sleep time and waking up time. EJ says, is it normal for the tip of your tongue to be numb after mommy makeover? I wouldn't say it was common. It probably has something to do with the breathing apparatus. Everybody knows it's like that ongoing joke, the surgeon blames anesthesia. That one is actually probably related to anesthesia. Something about how your tongue was positioned in your mouth during surgery if you recently had surgery. It's normal. It will get much better. Give that a few more days. Headaches, yes, headaches. See, I'm blaming that on anesthesia for sure. Yes, And can you wear a shirt under your binder? Yes, you can. is it okay to take collagen powder or pill supplements post-op? I know collagen formation is necessary for our breast to heal. Does too much collagen increase the risk of capsular contracture? I don't think so. That doesn't make any sense to me that it could be possible. Collagen is just amino acids, right? Like just building blocks of protein. And so you can take supplementation if you want, especially if you think you're not getting enough protein in your diet. But those amino acids are all going to break down and they're going to go become whatever protein you're making at the time. It does not make sense to me that you would make thicker scar around your implant or capsular contracture, which is felt to be related to inflammation, simply from taking a supplement. And so you're certainly almost, well, let me say differently, you're almost certainly not hurting anything. Kimberly says, does she have to wait till Friday? Probably, unless I get a cancellation for Thursday. But tomorrow I have clinic, so I can't do surgery. Another Kimberly, got a bunch of us. Is it normal to still get tired 1 month post-op when going out running errands? I get tired going out running errands, and I'm like a year plus post-op. Yeah, absolutely. It's a lot to recover from, you know. It's just not feeling yourself, and then for the however many weeks you weren't really on top of your game, like you weren't as active, and now you're pushing yourself to be a little bit more active. It's 1,000,000% normal. It will fade, I promise. I think I got to all your questions. It's a little bit after 5. I do try to do these weekly. I know my partners are doing them on Instagram as well. And you can always put your questions in the Ask a Surgeon section and then join us at bustmob.com and get in community. Have a great day.